as I said, is recorded with the consent of everyone. And if you have any issues with recording, please let us know, or please send an email or send a private message to Karen, and we will be very happy to do a separate session for you. It is important that we can review this for quality and improvement purposes, and also for our dear fellow aspirants of registered nurses in Australia to also have a look in the future. So are we good to start?
Yeah.
Yeah, perfect.
Yes.
So I'd like to request everyone if you can put yourself on mute when you're not talking, and please feel free to put yourself or unmute yourself if you want to talk or ask questions. All right, so I'll be sharing my screen. And Karen, thank you so much for continuously accepting other participants. Okay, so I just wanted to confirm with everyone that you can see my screen as Nursing Education Training Australia with the beautiful educators in your screen. Is that what you're seeing at the moment?
Yes.
Yep, perfect. Okay, so before we start, I'd like to acknowledge that we are living in an Aboriginal land, and that I'd also like to acknowledge all the elders past, present, and emerging, and welcome everyone for joining us here. And thank you so much for dialing in today for our information session for OSCE. So my name is Carissa, and I am the Education Manager of Nursing Education and Training Australia. And here with us today are also other members of the team. Co-facilitating with me today is Karen, our course coordinator, but I'd also like to acknowledge NETA members who are with us today. So first of all, I'd like to acknowledge Pradeep, who's here. Pradeep is our NETA marketing manager. And we have Carla Kong as well, who does your lovely resources for the OBA. So Carla belongs to the course development team. We do have our wonderful educators, Ross, Anamika, and Lovely as well. So thank you very much for dialing in. I haven't seen Daniela, but please let me know, Daniela, if you are here.
I see Daniela dialing in, but I'm not sure if she stayed. However, I think she has difficulty. But yes, she was around earlier.
All right. I thought I did see her, and then later on she was gone. But yes, so Daniela as well is one of our lovely educators who's here today. So yeah, a brief introduction about myself. So my name is Carissa. As I said, I'm the nurse manager for Nursing Education Training Australia. So we do cover a lot of services, and one of it is the outcome-based assessment, which Karen is the course coordinator. So brief of a background, I am a registered nurse myself and a nurse educator. I was based in Sydney for a couple of years, probably 7 years, and then moved to Wagga Wagga as one of the regional areas because it's very beautiful here. And I started my nurse educator role while I was in Sydney at St. George Hospital, and became the nurse educator as well for Southwestern Sydney Local Health District for the new graduate nurses, and the nurse educator for new graduate nurses in Murrumbidgee Local Health District. Now I am fully committed to nursing education and training Australia, and I am bringing my skills and my knowledge to this team. So thank you so much for dialing in. Karen, do you want to introduce yourself quickly?
Yes, definitely. I am the OBA course coordinator of Nursing Education and Training Australia, and I am the one who actually put on the schedule for our educators and any concerns regarding the classes of our students. I am also a director of nursing and one of the day procedure surgery here in Victoria, here in Melbourne to be specific. So for all Victorians here, yes, hopefully we'll be able to see each other soon. I've been working as a nurse for the past 10 years. I've worked as a nurse educator back in the Philippines for 2 years, and I've worked also in the UAE for 7 years. I was working as an in-charge nurse in one of the hospitals in the UAE. So I've moved to Australia because there will be a slide later on what's the reason why I moved here, but definitely this is a very lovely place. So I could not express this enough how I am so happy to have decided to move here. So hopefully I'll be able to meet all of you soon.
Thank you, Karen. I can now see Daniela. Hi, Daniela. Welcome. All right. So, very quick overview of this presentation. I just wanted to check with everyone if you can still see my slide. Yeah.
Hi, hello. I'm in the car. I don't
Hi. All right. So, Nursing Education and Training Australia, we do provide the outcome-based assessment preparation classes, and we do cover NCLEX and OSCE. Today, we will particularly cover OSCE. Just wanted to remind everyone that we will have a weekly sessions like this. So, it's either for OSCE, it's either for NCLEX, it's either for both, or it's either sample classes of both NCLEX and OSCE that we do provide. So if you want to grab the opportunity to learn something out of our classes, please feel free to follow our Facebook page, because the schedule will be put there, will be published there as well. So we will start the presentation for OSCE. So very quick overview, who are we? So we are a pioneering prep class provider for both NCLEX and OSCE. So we started providing this early 2020 when AHPRA and NMBA actually did. Sorry, I'm just hearing some background. When AHPRA and NCLEX are actually implementing the outcome-based assessment. So we work across the country. We do have our simulation laboratories, and we do provide OSCE as well through Brisbane, Melbourne, Adelaide, and Sydney. And our clients as well are overseas, specifically to those who are attending our online OSCE classes and also our online NCLEX classes. So we do have clients halfway across the globe. I would believe that we do have clients here dialing in from the Philippines, Nepal, India, UAE, Singapore, and thank you so much for the time that you've spent. I know the time difference, and thank you so much for that enthusiasm and your interest. Our main offices are in Sydney and in Wagga Wagga. However, our main laboratory as well is also in Sydney. So please feel free to visit us there if you have the time. And our lovely Prapti, our student support officer, is also very willing to help you when you visit our Sydney office. Karen, sorry, you're on mute.
Yes, thank you. So who are we? So we want you to know who we are. So our vision is for Nursing Education and Training Australia to be the preferred education provider for the outcome-based assessment of internationally qualified nurses. And our mission is to have 100% passing percentage for all OBA takers. So as internationally qualified nurse myself previously, we are actually for the nurses who want to be in Australia. We would like to be the people to help you come here and pass your NCLEX and OSCE.
I'd also like to add to that our dear educators who are here today, few of the many. So we do have Ross, Daniela, Lovely, and Carla. They're also internationally qualified nurses, so they do practice overseas as well. And one of their passion as well is to help you get to that finish line to be an internationally qualified nurse, to be registered nurses in Australia. And we do have the same passion. And sorry, just Anamika is here as well, by the way. So Anamika as well is an internationally qualified nurse. Just a very brief discussion about the values that we share in NETA, and all of our students current students and also our team follows the same value. So we value that everyone is knowledgeable, everyone here is a registered nurse, either back home or in Australia for those who are to our educators. And we value your knowledge. We respect that you have the capability and that your nursing council in wherever you are registered actually has the trust already for you to look after a patient safely and competently. So that's one of our values. We do value support. And for you aspiring RNs, one of our support is to mold you to become safe and competent nurses, to be able to look after the Australian community safely. We do respect you as a nurse and also as an international nurse, because that's where we come from. We value teamwork, and you can see that from our team up to the teamwork of our students as well. And of course, transparency. Transparency is very important to me. What you see is what you get, and we provide truthful and factual information.
So these are actually the steps and pathway. If you are going to check on the AHPRA's website, you have the first step before knowing if you are actually qualified for MCQ and OSCE. You have to do the self-check. And the first step is you're going to have the IQNM fee, which is 640 Australian dollars on the first day. And then you'll have your orientation. That's already part of the package when you give your fee on the first day. And the third is gonna be your portfolio stage. So this is the time that you are going to send to AHPRA your qualification, your identification, that is your 100-point identification, and your registration as an RN to which country you belong to, or you get your qualification from. And then you're going to wait once they give you the go signal. And that go signal, you will have the chance to book your ATT or your authority to take. And then you will take your MCQ that is around 350 Australian dollar payable to AHPRA as well. Once you pass your MCQ, then you will be eligible to proceed with your OSCE. So OSCE is actually held only in Adelaide. So all the students, wherever you are, you have to fly to Adelaide, because as of the moment, this is the only place that they're doing their OSCE. So it cost 4,000 Australian dollars payable to AHPRA. And once you pass this test, then you will now be eligible to be an Australian RN and join us.
I just like to add that the MCQ is 350 US dollars, and it's payable to Pearson VUE, and it is divided into two different fees. So the 200 USD plus GST is your registration, and your 150 USD will be plus GST will be your booking for your test. So being here for OSCE, I would presume that you have passed your NCLEX. To those who have passed, thank you so much and congratulations. You are one step closer to your goal. To those who are waiting for the result and wanting to know the process of OSCE, stay still and you still have that hope. And also to those who have just started the process and wanted to know about OSCE, you will get there. We do have students who already took the OSCE, which is actually their second to the last step of this process. So you will get there as well. So this is the slide where Karen was actually saying why she decided to move in Australia. And I think I'll share a bit of mine, but also Karen can share a bit of hers as well. But number one is the safety and security for ourselves. And safety and security is essential for me, and I currently live in the most livable city in the world, and I would say that that is Melbourne. That's where Karen is, but I am also in one of the livable cities in the world as well. But actually, Australia is a livable city, and that it is very essential for us to be in a safe environment. Healthcare is state of the art. I remember when I delivered my baby and my father was here and he was just so amazed of a public hospital having bathtubs and that facility where you don't have to pay anything from the time that you get admitted, have a heart surgery, go into a public hospital and you go out without paying anything and you have the best facilities. Fair and just in pay rate according to your qualification and experience. We do have fair work and we do have the award for nurses as well. Um, I would encourage you to go and visit there as to what is your pay rate. And you can see that we are actually very compensated. I am trained in the Philippines and I can say that my 1 month of salary is something that I earned over the weekend. So that's how just, and I think it's more than just pay rate. There's work-life balance for you and your family. You can go to beautiful parks, beautiful beaches, and just anywhere in Australia, there is work-life balance. You can see that as well when you see that family time is actually really valuable in Australia. I can't vouch for the scenic views. It's gifted with a lot of sceneries and also a supportive work environment. And I think our teamwork and transparency in Neta is one of that. Karen, would you like to add?
Yes, this view, the background is actually just around maybe 30 minutes from Melbourne, and you could see a lot of this kind of views just very close to even in big cities. So it's a very accessible, a very good place for you to bring your family for a weekend to go for excursion. So I could not vouch. This is actually my statement that Carissa has mentioned earlier, and just so happy coming here over. I've just mentioned that earlier though, but yeah, that's the thing that I could say regarding coming to Australia. So I would love people as well to experience what we've experienced. Thank you, Carissa.
Sorry, Karen, you're on mute.
Yes, so what is OSCE? So OSCE is a objective structured clinical examination. So it is delivered by AHPRA and NMBA in Adelaide. So practical component of the test is more into your behavioral skills. So you will be tested. So the test dates are released by NMBA. So whether you pass or you fail, and they will also be giving you a very detailed explanation regarding your outcome.
Thanks, Karen. In addition to that, I
Sorry, we could hear some noise at the back. Can you please put
that's okay.
yourself
I've
on mute?
muted
Yeah, thank
Marjorie.
you.
I'm sorry, Marjorie.
Thank you much.
So yeah, as Karen said, it's OSCE is an objective structured clinical examination. It is delivered by AHPRA together with the NMBA, hosted by the NMBA, and it is in Adelaide, and it's in Adelaide Health Simulation Center. At the moment, there is no other place where OSCE is being held. It is only in Adelaide. So you will be tested. I know that step 4 was your MCQ, and that it is a theoretical component. At this time, you will be assessed with your practical component. In your practical component, though, you still have to be assessed with your knowledge, which is a K in KSA, your skills, and also your attitude. So we will talk more about this in the next following slides. However, we want you to value that when you take your OSCE, you are tested for 3 things: your knowledge, your skills, and how you perform the procedure, and also your attitude towards it. How do you perform it according to the standard of the NMBA? So if you pass the test, you will then proceed to the registration process. So you can then apply for registration. If you fail, as what Karen said, there will be a very thorough feedback of your performance, so that you will need to reconsider this prior to retaking the test. So AHPRA has released a document in their website as to what happens if you fail. So if you, and we all have your email addresses, by the way, and we can send you the link as well. But if you go to AHPRA, go through OSCE, in the frequently asked questions, they also have details there as to what do you do if you fail during the exam. So you need to retake the exam, obviously. However, you need to reconsider before you actually resit to the exam, because the cost there is $4,000, and at the same time you won't be given the first priority at that time. And who will be given the first priority will be those who are who will be taking OSCE for the first time. So OSCE is being delivered per cycle, and in every cycle we do it's composed of 2 days, and each day is composed of 2 sessions, one in the morning, one in the afternoon, and the maximum number of candidates per cycle is 40 candidates. So you can imagine how competitive the places would be, knowing that they would only cater 40 candidates at a time.
So
So
if you're gonna, sorry, Caris.
that's okay. Yeah.
Okay. You can continue. It's all right. Yeah.
Do you want me
Okay.
to cover this?
Yes.
Yeah.
Okay.
So we do have some important words for you to remember. And yes, you can take down notes, but guys, we will be sharing this as well, so you can review this video. So it is a regulatory exam. And what does it mean when it comes to regulatory exam? It is very valid exam. It's a very measured exam as well. And we education providers and also the students are bound to the integrity of the exam. So there is a confidentiality agreement that you as candidates will be signing, because AHPRA needs to maintain the integrity of exam, and we at NETA is an advocate of that. We really want to make sure that the candidates that are actually passing the exam are safe and competent to look after the Australian community when it comes to safety and quality and according to the standards. So we are here to support you to be able to pass the test, and we're here to support you to be able to meet the requirement of the exam. And the preparatory classes that we do provide, which we'll be discussing later on, is according to the standards and according to the AHPRA handbook. The second keywords, ability and competency, and I think I did touch a little bit of that already. So the NMBA wants to make sure that you're able to and you're competent to perform the nursing skill safely. This should be based through the standards of practice. There are 2 standards that we nurses are following. One is the national standards, which is composed of 8 standards, and that was from 10. They did decrease that to 8, and we will be discussing that during our preparation class. And also we have 7 standards of practice as registered nurses that is required by the NMBA. So when you take your OSCE, you need to make sure that whatever you perform is according to these 8 and 7 standards of practice. The next keyword is communication. So this is very essential. Just wanted to share everyone that on my first day of my being a registered nurse, I had numb lips, and I was driving with my husband going home, and it was like my lips are so numb. I don't know, probably it's my blood pressure. And my husband's like, "You're 24 years old. You can't have high blood pressure." I said, "But my lips are so numb." Um, so we did review what did I do the whole day on my first day, and I was just talking from the start of my shift till the end of my shift. So it is because communication is integral, essential, vital when you become a registered nurse in Australia. And you will know that by knowing the core competencies, which then comes to the next keyword. So during your OSCE, you will be assessed with your skills. However, there are core competencies that you would also need to meet, such as safety, communication, um, therapeutic communication, correct patient identifier, making sure that you're performing the right procedure to the right patient. And we will discuss that as well because that's part of our program. But you have to make sure that your skills are actually holistic and it's actually integral for the care of the patients. Then we do have another keyword here, which is simulated. So yes, OSCE is simulated, and that is the reason why our program is designed to prepare you that it is actually a simulation. So when you do a clinical placement, for example, and you are going to do say, for example, the cardiopulmonary resuscitation, when do you get that in your clinical placement? It is very unlikely, or maybe one or two cases you will be able to practice that. In our simulated environment, you're able to practice these skills as many times as you want without hurting or without deteriorating a patient. So what does that mean is you will build your confidence until you get the competency. And then we do have reasonable adjustment. So this is actually found in your AHPRA handbook. And your reasonable adjustment would mean that if you have booked your test and you have some medical or mental reasons why you need the test to be adjusted for your favor, you can still do this. However, this should not break the integrity of the test and the procedure that will be the procedure that you'll be performing should not be different from the other candidates. However, this is part of the assessment process where if you have um, some conditions where you need some adjustments, it is okay to tell AHPRA beforehand. Say, for example, if you have type 1 diabetes, for example, and you need to bring in your medications, or you need to take some food in between because you're going for you will be hypoglycemic, for example, because you've just taken your insulin, just for example. So these are the conditions that you can tell AHPRA, and hopefully they will consider and do some reasonable adjustments for you. And the last two words here are your examiner and observer. So when you go to your OSCE, you will have the examiner, and this examiner will be the one who will be assessing you or grading you. And you also will have, sometimes there are observers in the room, and their main reason for being there is to observe. We do have invigilators as well around where you can ask for assistance. However, because it is a regulatory exam, you are not allowed to ask questions to your examiner. And even if you ask questions, the examiners are not obliged to answer your question. Also, your examiner might hold vital information where sometimes you need to ask your examiner a result or a report, for example. So in that case, they are fine to also talk. So this is all in your AHPRA handbook, your examiner, the role of the examiner and the role of the observer. We are expanding these terms for your better understanding. So you will have an examiner in the room, invigilators around, so that you'll be able to ask for assistance if you need to, and sometimes you'll have your observer. Because it is a simulated environment, you will be able to see either mannequins or real people as actors. So during your test, this could be real actors where you need to take vital signs, for example, or this could be your actors who will be performing or who are manifesting the symptoms, and then you'll be performing your skill to the actor. We do have some testable skills, and this is also found in your AHPRA handbook. So these testable skills are there as a guide, but it is not limited to all these skills. So there could be other skills that they will be testing. However, these testable skills are expected of you as an entry level of a registered nurse. So the first one is physiological observation. We do have vital signs, calculating drug doses, subcutaneous intramuscular injections, aseptic non-touch technique. We do have the resuscitation inside the hospital, and the defibrillation part won't be tested. Safe disposal of sharps, medication administration, including oral, subcutaneous, intramuscular, intravenous, and all other routes. We do have wound care as well, and that would probably include your wound assessment, hand hygiene, therapeutic patient communication as part of your second standard in both national and NMBA standards of practice. You do have infection control practices, patient identification, which is part of the standard again, and your intravenous therapy administration, and the management of your intravenous therapy that would include your IV cannulas. So all of these skills will be part of your, these are the testable items, and this is not limited to those skills. We are very proud to say that our program is actually matching to these, and we do have a lot of scenarios being reviewed by nurse educators, to make sure that what we have provided and what case scenarios and the competency assessments that we have is actually the practice in the hospital or in the clinical setting. Karen, is there anything that you'd like to add there?
Yes, definitely. So we made sure that our assessment is actually in tune, as what Carissa has mentioned. So because all our educators here in Nursing Education and Training Australia are all Australian RNs. So all our resources are in tune with the standards of Australia. So we are very proud to say that everything is actually according to AHPRA's guidelines.
Thanks, Karen. And having our educators who have actually done a lot of assessments already, and this is our bread and butter, doing assessments, teaching skills. And Ross, Anamika, Daniela, lovely, who are here today, can vouch for that, that this is what we teach every day, and that these are all based in an Australian standard of practice. So we do believe that principles are the same in different books in different countries, but the reason why NMBA is actually testing us the skill is to ensure that we're actually safe and we're actually demonstrating this according to the Australian standard of practice. So the NMBA does not endorse any provider of OSCE, and they do have different resources that you can access. So for your preparation, so there are different types of resources, and these resources are also available from NETA. So we are very generous to our students. We do provide these resources to them. A few of them are actually found as well in the internet, and the application of these resources are being taught in your preparation classes. So the first resource is the Australian Commission on Safety and Quality in Healthcare. So this is what I was talking about. This is where the 8 standards of practice would be located. So the 8 standards of practice will be discussed in your online session. However, we make sure that each procedure that you perform will be according to these 8 standards of practice. There are procedures that belongs to different types of standards. So say, for example, standard number 5, which is comprehensive care, and comprehensive care would cover a lot of skills. Pressure injury assessment and management, for example. So we do have a lot of scenarios that would actually teach you how to manage this and how to assess this in an Australian healthcare standard. We do have the Australian Medicines Handbook and also Australian Injectable Drugs Handbook that we use for our students. Then we do have Jarvis Physical Examination and Health Assessment, which is part of the preparation as well. And in our program, we also integrate the physical examination health assessment. We do have the person-centered approach to care, which is our standard 2. And this one is also integrated in your preparation class. My favorite is Tollefson's clinical psychomotor skills assessment skills for nurses. We do not also, these are all recommended books. We do not recommend which one is the best because all of them are very important. However, the assessment skills for nurses by Tollefson is actually very comprehensive as well. So most of our assessment tools are also based there in conjunction with other resources. We do have the NMBA professional standards, which would include your code of conduct, code of ethics, and also your 7 nursing standards. So this is how you're going to think critically, partner with your consumers, and then the capability of practice. And then it goes, it then integrates your assessment, planning, intervention, and evaluation. So these are the 7 standards of practice. And NMBA, who will be conducting the test, will ensure that all of the procedures that you do in Australia is based on these standards of practice. If you're going to be assessed for an audit as well, this is where they will be basing. So this is a very important document. And as I said, the application and the integration of your skills through this will be taught during your preparation classes. And of course, we do have some pathways, charts, some algorithms that are Australian standard. And I think this is the reason why our students said that the preparation is actually very important to them, because you do have all these resources. However, it is very essential for them to actually know how to apply this in their skills. So we talk about charts. We do have different charts and algorithms that we follow in Australia that is quite different to other resources from other countries. So say, for example, the observation chart. We do have a chart we call ADD or Muse. We also have between the flags. However, we do the Muse and ADD charts that is recommended by the Australian Commission on Safety and Quality in Healthcare. We do have different algorithms. So say, for example, your doctor's ABCD for your CPR, for example, which is Australian standard. So we will be teaching this, the students and the candidates on how to be able to do those skills.
So what is exciting about Neta's OSCE preparation? So definitely we will show you these for you to have an idea how to enroll in Neta. So the whole preparation course is 3,500. So we have 2 weeks of online class and 5 days, full days, hands-on training in our simulation laboratories across Australia. However, there is one thing that I would like to add on this. You will be able to access these services for the next 6 months. So if even you already attended the 2 weeks of online class, you are still able to attend on the next month for the online class and another month for your face-to-face. So you can master it as many times as you want for the next 6 months. Our resources, we have pre-recorded videos of skills in your learners portal, Neta's design OSCE workbook in conjunction and in accordance to AHPRA and NMBA standards. We have competency assessment tools designed according to OSCE test plan, national standardized tools, pathways, resources according to the Australian healthcare practice. Neta designed as well in hospital charts, so you will be able to practice how you're going to do your documentation. Coming from an internationally qualified RN is totally different, so we don't want you to be shocked when you go to your test. So it is really good that you will be able to practice all these charts that Neta will be providing for you. Our online and face-to-face session that I mentioned earlier, and as well 6 months access to your from the day of your enrollment. So we would love you to be on board as an Australian RN and to be part in the register in AHPRA soon.
Thanks, Karen. I just wanted to tell everybody, by the way, that that photo was taken by Karen. So that's the sample of our workbook that Karen was mentioning.
You're seeing my desk right now.
That's Karen's desk, by the way. What is exciting about our educators? This one was taken on December 2020. I know that Daniela, Ross, and Anamika are here today. However, in our next development day, definitely you'll be here. This was taken in Sydney. So what is exciting about us? So we are a team, and I vouch for that. We are all AURN qualified educators. All of your educators have postgraduate qualifications, training and assessment qualifications, and they have been doing this over a long period of time. It is their bread and butter. This is what we do every day. We are all Australian qualified trainers and assessors, and also majority of us, I think 99% of us, are actually international trained nurses as well. So we have been in your shoes, and we actually know what are the things that you need to unlearn to be able to learn an Australian standard of practice. We are highly experienced, and yes, we do practice in Australia. Majority of our educators have more than 10 years of experience, some 20 years of experience, who has been doing these skills over and over again. We are young and vibrant. I don't think we are old, and I don't want to say as well that we are old. I really think we are young, and we are very enthusiastic, full of energy. And of course, most of us are up to date with the current evidence-based practice in Australia. All of your skills that will be tested in your OSCE are all current, are all evidence-based practice. I know that at some point there was one time that we are putting an egg white to the back of our patient to relieve from pressure injury. We don't do that anymore because there is no evidence that says that it is actually a good practice. We are clinical leaders in major hospitals and healthcare facilities. What does that mean to you? We're able to help you after your registration. When we say clinical leaders, if we are not nurse unit managers or director of nursing, we are bedside leaders as well, and nurse educators, which is actually a leadership role in nursing. So we are here to support you, and that is what is exciting about us, aside from being young, vibrant, friendly, and smiling. Is there anything that you'd like there to add there? Karen, Ross,
Yes.
Anamika, Daniela, and Lovely, who's here with us today, and Carla.
So definitely, yes, I would like to highlight the term used by Carissa. She said, I would, students actually unlearn, and it is coming from their mouth. Like they say, I would like to unlearn those skills that I have used, or that I am used to doing back home, because they realize that it's actually not done in Australia. And that is a very crucial thing, because Australia will be very particular, as what Carissa said. It will be based on the standards of NMBA and AHPRA, and you have to know that the things that you are doing is actually safe, and what is actually recommended. So we are here for you to unlearn those things that we don't need to implement here in Australia.
And also, I would just like to add, as Carissa said, some of us, or mainly of us, are working in a public system and a nurse educator in the district. So we're abiding in the Australian standard for all the registered nurses that we are training in the hospital setting. So if there would be any updates or changes, we will be able to incorporate it to you so that you will learn it as well as you go along if there's any changes.
Thanks for that, Lovely. I like it when you said that if there are any changes, we are currently up to date and updated. Otherwise, our standards are not met, and if we do not meet the standards, we are in trouble, specifically during audits. So Yeah, is there anything else that you'd like to add there, Anamika, who's here today, and Ross? I know that you are passionate about education. What's exciting about you?
Hi everyone. I'll just sort of like I just want to say initially, obviously, congratulations for everyone. I do hope that you'll stay or you enjoy your stay with us in the future if you're going to be enrolling. Trust us guys that you'll make it through you by the help of our educators, like what Carissa and everyone says. Most of us are very highly trained in delivering courses, particularly with OSCEs and NCLEX. We have all recency of practice nurses doing all the updates for us. But I think my biggest tip for everyone is, this is what I've always been, my guiding sort of idea when I started. By the way, I'm also an internationally qualified RN. And during that time, I was sort of like thinking, how am I going to acquire more knowledge when I came here and relearn all the new skills? So I think my sort of guiding principle is, keep your cup, um, keep your cup not full. So what it means is always allow extra space for you to learn more things, because really what you practice back in your country may or may be different from what we do here in Australia. And our job is to make sure that we streamline all the skills and practices that you've done back in your country to make sure you be a safe practitioner here in Australia. And like what Carissa and Karen suggested, we followed national standards of nursing practice here. We followed the register, the national quality and safety standards as well. So there are some guiding principles that we have to follow. And the way OSCE would work is based on those standards. So we need to make sure that every single thing that we will have to teach you are based on those standards, and you be a safe practitioner. So yeah, that's all. All the best, everyone. Thanks, Carissa and Karen.
Yeah, hello everyone. I'm one of the Neta educators, Anamika. I would also like to add something. So, when I first came to Australia, I had to do the bracing program and go for a placement in hospital. And whatever I learned in the hospital was completely different from what I used to do back home. All the practical skills like dressing, IV, cannulation, and everything is completely different. So, if you compare that with OSCE as well, you will be asked to do similar procedures, but then they would obviously want you to do it according to Australian standards. So because of that as well, it is important to learn how it is done in Australia in Australian standards. And the next thing is that I would like to congratulate everyone who have passed NCLEX. I'm so excited and happy that whoever gave NCLEX test, they passed, whoever studied in Neta. So congratulations everyone, educators as well as our students, and good luck to those who have given their OSCE. Thank you.
Thanks, Anamika, Ross, and lovely for your input. That's really valuable. So we will be discussing about what will happen during the exam. So this is found again in the AHPRA handbook and also in the frequently asked questions. However, I'm very happy to elaborate this based on NETA and my understanding. So each session will go for approximately 3 to 3.5 hours as per the FAQ. You may be given a schedule that would say 3 hours as well, but put some adjustments there between 3 to 3.5 hours. There will be 10 individual stations, and each station will be different kind of skills that you need to perform. You will be given 2 minutes of reading time. So if you can see this in your AHPRA handbook, there is that OSCE stations. Outside would be the iPad or that tablet. The tablet, I mean. So that tablet would actually have your scenarios. That's where you're going to swipe in your identity card or your ID card, and that will then trigger your scenario once you're being identified. So you have 2 minutes of reading time. This is a very crucial stage because you need to analyze, you need to know what are the things that you're meant to do at this point. Once you finish the 2 minutes, you will then go inside the OSCE station, inside the performance room, and that's where you need to have your 8 minutes of interaction time. So, or your performance time. So the 8 minutes again is very crucial because that is where you will be assessed by your examiner. So, going back to the skills that AHPRA is recommending, let's give a scenario. Say, for example, you're doing an aseptic non-touch technique, which is your skill number 5 in the recommendation. So, what you will be doing then is you will have 2 minutes of reading time as to what your scenario is. And when you go inside the station, this is where you're going to perform your aseptic non-touch technique. Aseptic non-touch technique is a broad nursing term, and it could be any procedure that would refer to an aseptic non-touch technique. It could be your wound dressing, it could be a medication administration, it could be any procedure that would involve sterile to sterile, non-sterile to non-sterile environment. So, and we will have a lot of scenarios when it comes to aseptic non-touch technique as well. However, there will be bells and announcement that will give you the clue when you do your OSCE. So the first bell is the start of your examination. This is where you will begin your 2 minutes of reading time. The next bell that you will hear is the end of the reading time. What does it mean? You need to enter the room. So you can imagine that 10 rooms with 10 candidates. All of you are reading your scenario for 2 minutes. The bell then rings. All of you will then go inside the OSCE station. You will then have 8 minutes to perform. However, you will be told that you will have 1 more minute left of interaction. So that time, in that case, you will have 1 minute to wrap up everything so that you will be able to finish the required skill. After the 1 minute, there will be a bell again, and that would signify the end of the station time. What do you need to do? Everybody who is inside the station will need to go out of the room and then prepare for the next reading time in the next station. So no special considerations here. If you did not finish the task, you are still required to go out because there are still other 9 candidates who will be also doing the same with you. So very important, 2 minutes of reading time, 8 minutes of preparation time. And this document has been accessed as of today. This might change in the future. So if there are any changes, I would recommend, or if you don't know, you're about to take the test or you're preparing for the test, I would recommend to go again to the AHPRA website or the Nursing and Midwifery Board website, as this may change in the future. But at the moment, as of today, this is the most current information when it comes to the testing time. Is there anything that you'd like to add there, Karen?
Well, in that scenario, our main responsibility as an educator is actually how for you to be able to be confident when you deliver the skill. So that is where we come in. So for you to be confident, competent in delivering the Australian standard skills.
When we delivered the OSCE scenarios to our students, we actually do time the 2 minutes and the 8 minutes, because there would be some questions. How can I finish a medication preparation in 8 minutes time, for example? It is achievable. And as we said, the OSCE exam is valid. It is measured, so therefore it has been tested, and the 8 minutes of performance time as well is valid. So we have timed this as educators ourselves, that we're able to do this skill, and then we teach our students to be able to perform the skill in 8 minutes. So you'll be able to finish the skill safely. This is very important. You need to finish the skill, but it needs to be safe, and you need to be competent as well when you finish the skill. After the exam, so once you finish all the 10 stations, what a relief. You are now done with your 10 skills. So you need to leave your clipboard and your ID at the last station where you left. You need to follow the invigilator to the waiting area, and there will be a post-examination debriefing. So according to the AHPRA handbook, this is a debriefing for 5 minutes. It's very quick, and you follow the invigilator as they escort you out of the building. Always remember that as candidates, you are bound to the confidentiality rule. So you are not allowed to share whatever has happened during your test. So this is part of your agreement with AHPRA. And as you become registered nurses, this will be part of your code of conduct as well. We need to make sure, and I am a strong advocate of this, that we need to make sure that the integrity of the exam is actually maintained, because we really would like to have safe, competent nurses. Just imagine we will be there in the hospital. We need to make sure that the nurses actually looking after us are safe and competent to perform the procedure. So that is the reason why we're strong advocates of this confidentiality. So you as candidates, we strongly recommend that, not really recommend, we will tell you to follow this confidentiality agreement with AHPRA. So these are the general tips that we got from our candidates. We are also bound to their confidentiality, so we are not meant to tell you who they are, but we did send a few candidates already for their OSCE exam. And these are the general tips that they told us that was really essential and beneficial for them in taking the test. Number one, the preparation class was very essential and beneficial for them. They said that when they went there, they were actually there prepared. They had the full bullets with them, with the knowledge, the skills, and the attitude. They actually were very confident to go there because they know that whatever the scenarios would be, they are very knowledgeable. And during our online and face-to-face classes, we actually put a lot of skills and a lot of powerful words for them to use during their test. The next tip is that you need to be there being prepared. It is very essential for everyone who takes the test to be there prepared. And I know that you've done your NCLEX, and I know how much preparation time that you've put into your NCLEX. It is the same as OSCE. We did have students who said, I thought NCLEX was easy. I thought NCLEX was very hard. This one is a practical component and it's easier than NCLEX. Most of our online students, on their first go, before they attended the face-to-face training, they actually verbalized that it is actually harder than NCLEX. And it is because all of the procedures that you are going to do is actually based on the standard: 1 step, 2 step, 3 steps. You need to make sure, am I following the standard? Is this against the standard? Is this what is expected of me as a registered nurse in Australia? So you need to be prepared physically. So don't go there with an empty stomach. We really recommend that you go there with your stomach being fed. Be there mentally prepared as well. And what does that mean is that you need to make sure that when you actually go there, you are physically and mentally present. So you need to have that mindful moment that you're actually there to take your test, and also be there emotionally prepared. So I know that when you go for a test, not just OSCE, in any other test, there are a lot of emotions that's going on. You will have mix of emotions. You'll have the excitement because finally this is what I've been waiting for, to become an RN in Australia. And then you go, oh my God, I'm so anxious because I'm not sure what is going to come out of the test. But you need to compose yourself and manage yourself, that yes, anxiety is normal. However, I need to get this done. So I need to still focus and prepare and make sure that I am mentally present. Positive self-talk. This is what the majority of the students said. There is no one else that can help you. No one else can give you positive talk other than yourself. So positive talk, saying that you can do this, you've done NCLEX, you've gone so far, why not at this time? We did a briefing session for our students prior to them taking the test, and I was very impressed of all the positive talks that they actually did for themselves. One of that is saying, why would I ruin the day of my exam when I have prepared so much from NCLEX and now to OSCE? Why would I ruin that day? um, I can do it. I've done all the other steps. Why not this last step? So that's an example of a positive talk. Um, Next one is try going to the testing center a day before to estimate the travel time. I know that there are a few of candidates who actually do this, and they said that it's really helpful because you don't know how the traffic is at that stage. You don't know if there are delays, for example, of trams to and buses to the Adelaide Health Simulation Center. So going there a day before the test, and even timing it to the exact time that you will actually be there, so that you can see how is the traffic light, how is the traffic like during that period. So it is easier for you to actually prepare yourself physically and emotionally. Just imagine running there because you're getting late. You don't want that to happen. You don't want to add more stress to yourself. In your letter, it will say from AHPRA, it will say arrive there early. It could, I think the NCLEX as well said there to arrive 15 minutes or 30 minutes before the time. If you don't mind waiting, arrive there earlier than what is recommended so you won't stress. You'd rather wait than gasp your breath because you're getting late. So anxiety is there, but focus is a great factor to perform the skill. So our test taker says there's always anxiety. Even when I took my NCLEX, there was anxiety. Even when I took the national boards in my home country, there was anxiety. It is always there. It is actually a positive challenge. It is a positive stress for me to be able to focus. So that is a great factor, the focus, because once you're anxious, you put yourself back to reality, back to norm, and refocus, you'll be able to um, perform what is expected of you. Always ask yourself if you're performing the skill safely. And this is what we always advise our students, not just for OSCE, even for NCLEX. We always tell our students, each time you make a decision, you have to check, am I promoting health or am I promoting death or deterioration of my patient? If the answer is a positive, then yes, you're doing it right. If the answer is you're promoting deterioration, then oops, you have to stop. You're doing it wrong. So always have that constant reflection whether this is for the benefit of your patient or if this will not benefit your patient. Take a deep breath. If you get lost, compose yourself and refocus. We always tell our students it only takes 10 minutes to compose yourself and to put your focus back. So they said that this advice was really helpful. And after the test, there is no point in blaming yourself. We know that you have done your very best. The only thing that you need to do at that time is actually to look after yourself. So make sure you have that self management. You're able to do some self care. You don't hesitate to ask for emotional support. If you're enrolled with NETA, our support is always available after your test. If you need emotional support, we are here to do that. You need to be hopeful. There is that one bit of hope each time, even, and this is a lesson, that even if there are skills that points that have been missed, but there are still a lot of skills that were actually done safely and competently. So there's still that bit of hope. Know that there are a lot of options no matter what the result is. Worst comes to worst, what's going to happen? Worst comes to worst, the thing that's going to happen is you'll fail the test. We don't want that to happen. You're advocates for your success. But if that really happens, you know that there are still other options for you. So it's not the end of the world. So this is our team, and we are here. We do exist. So give us a call if you need more help and support. We stand by our mission, our vision, and our values. And if you need further information, don't hesitate to contact us or visit our office. If you are outside of Wagga and Sydney, we do have a 1-300 number that you can call. We do deliver our OSCE across Australia in major cities. So if you are from somewhere, give us a call. I know there are a lot of people here from Victoria. We probably have candidates from Brisbane, or not just Brisbane, but okay, let's do it per state. Queensland, for example, we do have people from New South Wales. We are here. Give us a call. You do have our Facebook as well, which is NETAOBA. And we also have WhatsApp to those who are overseas. So you can always send us an email. That is our website, by the way. If you want to see some experience of our test takers, they're all in the website. So please feel free to browse. And also, if you would like to know some updates, our Facebook page and our website is constantly being updated. I think that is the end. And I'm happy to review the questions. And I know Karen has been answering them as well. So thank you so much, Karen. Is there any question from the group? I'm just scanning through the questions. Karen, is there any question that you would like to share to everyone from the chat?
Oh yes. A few have sent me a direct message, and also it was in the message for everyone. They were asking regarding if they have not practiced nursing for the past 5 years. So for you to be able to take OBA, as long as you belong to Stream B candidate, you are allowed to take OBA. However, when you do your registration, you will have conditions in your registration. One of it might be a guided practice until you get your full registration. Just like you get your learner's permit or your probationary license in your driving license, you will have some condition before getting your full registration.
Thanks, Karen. I'd like to add on that as well. So we are education provider for NCLEX and OSCE, the best person or the best agency that you can contact with regards to your pathway after your OBA is AHPRA. So we recommend that you contact AHPRA because your conditions might be different from others, and the best authority to actually give you the advice is AHPRA.
Definitely. That is the best answer, Carissa. Yes.
We do know of some candidates, though, who have conditions with their registration or who has gone to a different pathway, and that is fine as well. We know of different people with different types of pathways, so it will be case-to-case basis, and you'll have a case officer for your case with AHPRA, and it is best to ask them. Can I repeat the 1 week face-to-face training? I think Karen has answered that. Yes, definitely. So your face-to-face training is accessible for the next 6 months. So if you really want to be confident with the skills and the scenarios, definitely you can attend as many trainings as you want within the next 6 months. We do have students who have attended several trainings and several face-to-face and several online sessions with us, and that's not something that we mind at all. We actually encourage our students. You will probably receive a lot of emails from our student support encouraging everyone to rejoin the classes. Our main goal here is 100% passing percentage of all OBA takers. And if that is something that we can help and support you, that is something that we will do to be able, for you to be able to pass the test.
There is a question here, Carissa, asking about the borders for international candidates. Currently, the borders are shut. However, there are some consideration that you can apply for exemption. So one of it is for those students who are actually going for their um, training already for the hospital, for for the students who are doing bachelor's or doing let us say conversion, for example, if they're going to do their practical. However, with regards to OSCE takers, you could try to seek for exemption. However, we are not assured, we cannot give assurance as it is only um, the immigration who are actually responsible for approving such requests. So we cannot say anything regarding that.
Thanks, Karen. In addition, on my screen is the Home Affairs website. So go to reliable sites, as what Karen is saying. The homeaffairs.gov.au is the best website that you can go to for you to be able to check travel exemptions, and also if they're open to critical care workers, for example. So if you would like to contact them for your case, that would be fine. It is best for you to contact the Department of Immigration, and that is this is the website, by the way. It's covid19.homeaffairs.gov.au/travel-restrictions #TOC. I might copy that and put that in the chat box so you can have a read, but definitely give them or contact them if you would need. So I hope that went through in chat, and you can copy and paste that if you're outside of the country. Thanks, Karen. And I hope we answer those questions. There is also a question there. Can someone who has done 3 years diploma plus 2 years bachelor's do an OBA? So that's from Rahul. I think Karen did answer this. Is that correct? Do the self-check?
Yes, it's better to do the self-check, as what Carissa has mentioned. It will be case-to-case basis. One student will totally have different approach to another, and it's only AHPRA who could give you the best answer to that. So having a self-check done, it's all for free. Doing a self-check, then you will be able to know if you fall to a stream B candidate, or do they need to do further assessment for your qualification. AHPRA will be able to answer your questions and your queries.
So on the screen at the moment is our website. So if you go to nursingeta.com, you then scroll down to the bottom, and you can see a pink tile that says OBA preparation class self-check. So if you click on that self-check, that will lead you to the Nursing and Midwifery Board of Australia's website, and down to the bottom is where you will then commence your self-check. So you can go straight to the Nursing and Midwifery Board of Australia website. However, there are a few steps that you need to go to. The easiest way is going through Neta's website and then do the self-check from the homepage.
We also have
yeah, and then you will know what is your pathway that is advised by AHPRA.
So we have a question here. Do you offer employment placement after AHPRA registration? We do have another webinar regarding employment placements. So we are happy for you to join that webinar. We will be posting that shortly in our website and in our Facebook page for the exact time, exact date of the webinar. And we will be very happy to answer some queries regarding work placement. As up now, Neta is actually also looking into helping our students, stay here in Australia. And we have tied up to reliable agencies to help you achieve your dreams staying here.
So yes, definitely one of the services of NETA is to help you stay in Australia after your registration. However, Australia, we abide to the guidelines of equal employment opportunity. So what does that mean is that everyone would still have to go through the recruitment process of interview and the selection process, making sure that your police police check, you're not a criminal, you're registered with AHPRA, you don't have any conditions, so and so. And if you would meet those requirements and then you pass the interview process, we do partner with different industries that could actually help you with sponsorship and employment. This is another webinar because it's another hour of information session, but definitely that's something that is on the table for you to be able to stay in Australia, work, and also obtain a permanent residency in the future. That's another part of the service.
So answering to EXA, we've mentioned earlier, we can go to our website, nursingeta.com, and then at the bottom, you could click onto self-check, and you will be able to know what your pathway will be, as AHPRA is the one who will be able to answer if you are going to an OBA pathway. So it will be best to look into the self-check. It's for free.
All right. I think that is the end of the questions. So if you do have further questions, we have our Facebook page that is really active. So please feel free to add us in Facebook. It is NETA space OBA. And we will be in touch with you there. And if you have further queries, our phone is also open to everyone. So it's 1-300-00-NETA or 6382. I think that's it. Do we have any other questions? All right, everyone. Thank you very much I was waiting for that 8 seconds in one of the facilitation workshop that I've attended. They said, wait for 8 seconds before you talk. So 8 seconds gone. Everyone, thank you very much for the time that you have spent. Again, this video is recorded. We are posting this in our social media pages for you to be able to review and also share to those who would benefit this information. We are running weekly sessions. It could either be about NCLEX or OSCE or employment or all of it. Keep posted in our Facebook page and also in our website. And if you have any questions, feel free to send us an email, WhatsApp, Messenger, or give us a call. Thank you so much, everyone, for your time. And if I'm just stopping the sharing of my screen, and it's really lovely to meet all of you.
Thank you, Carissa.